For complete study materials and other assistance, contact Nursing Manthra through WhatsApp on 971502515717. Question number 2. A nurse is preparing to administer an intravenous infusion of 2000 milliliters of Ringer's lactate over 12 hours. The administration set has a chamber that delivers 15 drops per ml. How many drops per minute should be administered? A. 14, B. 24, C. 42, D. 56. The answer is C. 42. Question number 3. Doctor ordered to give medication X 300 mg and available is 900 mg 6 milliliters. How many ml the nurse will give? A. 1.2, B. 2, C. 4, D. 6. The answer is B. 2. During CPR of an admitted patient following the cardiac arrest, 2 DC shocks and 1 dose of epinephrine was given. A third dose was delivered followed by antiarrhythmic medication. What medication is the most likely to be given next? A. Adenosine, B. Lidocaine 2 mg, C. Epinephrine 1 mg, D. Sodium bicarbonate. The answer is C. Epinephrine 1 mg.